Hi there, my name is Kate Morrison, and I'm a certified veterinary technician at BluePearl Pet Hospital in Sarasota, Florida. Today I'm going to talk to you about how to monitor and assess your pet's bandage at home. It's also important to make sure you're following your veterinarian's instructions as far as how often you should bring your pet back to your vet to have the bandage changed or replaced. When monitoring and assessing your pet's bandage, it's important to gather any materials you may need. One is a camera to take visual documentation of what your pet's bandage looks like on a once to twice a day basis. A phone or a normal camera can be used for this. Waterproof material for the outside of your pet's bandage is also important to keep in mind when taking your pet outside for walks. You can use something as simple as a Ziploc bag, rubber gloves, or even something as simple as a poop bag to cover the outside of your pet's bandage. To protect the bandage from your pet, it's recommended to place an e-collar around your pet's neck so they aren't able to chew or lick at their bandage. This is Georgie Girl. She's going to help us demonstrate how to monitor bandages at home. So we just placed a new bandage on Georgie's front left paw. So it's very important if your pet has a bandage to make sure that we're doing visual assessments at least twice a day to make sure we know what it's supposed to look like. So I recommend before leaving your vet's office to look thoroughly at the bandage, how high it is on the limb, and also how many toes are exposed. You could use your cell phone camera to take pictures daily to notice any minute changes in the bandage, but we really just want to look for any slipping and you okay, girly? And any changes in what we're seeing at the toes that are exposed at the bottom here. When assessing your pet's bandage, we want to make sure that it's clean, dry, and intact. Using your baseline photos, you could compare the top of the bandage to make sure that there wasn't any slipping that's occurred over time. And also we want to look at those toes at the bottom if they are exposed. And we want to feel them and make sure there's not any excessive swelling. And we could use the normal foot to compare the toes to see if there is any swelling that's developing. If your pet isn't under direct supervision, or if they have a curious mouth, we want to make sure that we're applying an e-collar to them so they don't chew or lick at their bandage. You can get an e-collar at most pet stores and also from your veterinarian. So when applying an e-collar, you want to go under their chin and around their neck. They might be a little worried, so we want to make sure we're giving them plenty of encouragement, reassurance, and treats along the way. We'll wrap the e-collar around their neck. We want to make sure we don't close any ears or any other areas of skin before snapping our e-collar parts. Some e-collars fasten in different ways, but this one has some clips. So we are just going to clip the plastic pieces into the holes. It's okay, honey, you're a good girl. I know, it's a scary sound, but you're doing so good, baby. And for a proper length of an e-collar, we want to make sure that your pet's nose cannot go past the edge of the collar. That'll ensure that they won't be able to reach their toes. Good girl, you did it. So when you take your pet outside for a walk and they have a bandage, we want to make sure that we apply a waterproof barrier to keep the bandage dry and clean. You could use different household items if you're not provided with one, or if you don't purchase one from a store. You can use a Ziploc bag, you can use a stretchy glove, or you could use one of your dog's poop bags. To secure it, we recommend a little piece of tape temporarily. You could alternatively use a hair tie or an elastic band, but the major takeaway of covering your pet's foot is to remove the covering after, because we're trying to prevent water from getting in, but also we don't want to trap anything under that waterproof barrier. So walks only is when you would apply this barrier to your pet's bandage. So we're going to go outside for a walk with Miss Georgie. So I'm going to take my waterproof barrier and put it over her bandage. We're just using a poop bag for this demonstration. So we're just gonna slide it over her bandage. Sometimes you could tie a little knot in the side of the bag. Other times you could use a little piece of painter's tape or a hair tie, but we also want to make sure that we're removing those after use so they don't cause excessive pressure over the limb. Tying works pretty well. When assessing your pet's bandage, it's very important to assess it at least twice a day to make sure we notice any changes quickly before they become a problem for your pet. Using your baseline photos that you took when your pet first had their bandage placed could be a very good point to compare and contrast what you're seeing now compared to what the bandage originally looked like. These pictures can be very helpful, and I do recommend taking them every time you assess your pet's bandage if you're concerned. When assessing your pet's bandage at home, there are a few things to look out for that would warrant taking your pet to your veterinarian. You want to make sure that the bandage has good integrity still and is clean, intact, and dry. If you notice that the bandage is soiled, wet, or not as clean and precise as it once looked based on your baseline pictures, we would want to bring your pet to the veterinarian to be assessed. Other indicators that could mean that the bandage is no longer performing the way it should is if your pet's gait changes or they seem uncomfortable using that leg. If they were using it well initially and all of a sudden their gait changes or they don't want to put weight on that leg, that could mean that the bandage potentially slipped. Could potentially be causing a pressure sore that would cause your pet discomfort, which would warrant the bandage being replaced sooner than initially recommended. Other things to look for is around the edge of the bandage where it meets your pet's skin to make sure there's not any excessive inflammation in those areas. And if there are, we would recommend having the bandage replaced sooner.